Welcome back to the YouTube channel. Today we're going to be talking about intradiscal injections. In particular, I'm going to mention about a company that has an off-the-shelf product that can be injected into the disc. This is called Via Disc, and essentially what it is it's purified disc material that can be injected into a degenerative disc. Now, what kind of discs are we looking for in this case? We're looking for obviously a degenerative disc where the material inside the disc has lost some of its water and some of its cushion. A normal disc on MRI, you can see inside the disc that there's healthy disc tissue and water inside the disc. And what happens as we age, and this happens to everybody, is you start to see that water leaves the disc and the retention of water starts to fade, and what you start to get is tears in the little fibers and drying out of the disc. And what that will result in is essentially a collapsing of the disc due to that loss of water. And so what this particular procedure can do is to put purified disc material back into the disc using a needle under X-ray guidance, and we'll get to that in a second. But essentially it's off-the-shelf purified disc material that can be re-injected into the disc to basically get that water back in the disc. So what's done is with light sedation and under X-ray guidance, guide needles and wires are placed into the disc. And through that needle, we're essentially injecting this purified disc material. So this material has been sterilized for safety purposes, but essentially it's cadaver disc material that you're putting back into the disc. And what that's going to do is allow the water to come back in so that you can regain the height of the disc and try and get a bigger disc height. Now, if you have a fused disc, this would not be a good option. If you have a severely degenerative disc where there's realistically no chance of plumping that disc back up, this is probably not a great use of your time. But if you have a disc that's borderline degenerating, could be slightly herniating but contained, meaning it's not disc material pouring out into the spinal canal, you have to be realistic about what kind of disc you think you can salvage with this technique. But it's a minimally invasive procedure. Essentially, you're just placing one needle under X-ray into the disc, can be done with light sedation, basically twilight type situation, and takes all of about 5 to 10 minutes to do the procedure. So a nice option to try and help a moderately degenerative disc that's not a surgical disc at that point. Not all the insurances are covering this yet, so this is a bit of a new technology in terms of an option out there. Some people, do have concern that it's cadaver material that's being used, but it's been purified, processed, and there's a lot of different scenarios where we use cadaver type materials, especially in orthopedic with ACLs and other things. So this isn't as outside the box as you would think in terms of where the material comes from. But I hope you find this helpful. Just wanting to share some new cutting edge modalities. If you like these videos, please make sure to like and subscribe so that other people get pointed to the channel. I appreciate your time. If you have any questions, please feel free to put them in the comments. Obviously nothing that's private medical information, just general questions, please.